So we're here at the Healthxchange Academy today, and we're here with the UltraLUX Pro series machine, and we're going to be doing a photo rejuvenation treatment using a 590 nanometer wavelength. Our patient's main concern is superficial pigmentation with a little bit of superficial vascular flushing. Using the 590 nanometer wavelength, we can target the oxyhemoglobin, which is the red component of the superficial vascular issue, and we can also target that superficial melanin in the skin as well. We have gone through a thorough consultation process whereby we've taken the client through a series of medical questions, ensuring that they're not on any form of photosensitive medication and they've not been in the sun recently and exposed their skin to the sun, as well as ensuring there's no residue on the skin whatsoever, so no fake tan, no makeup on the skin. So I have fully cleansed the area. I have marked out any local contraindications that I do not want to treat with white pencil, and I've also marked and gridded the face area out just to keep myself right. Next steps would be to obviously go over the area with some ultrasound gel, and then I'll go over with our device. Our device has an inbuilt cooling, ensuring that we keep the epidermal layer of the skin cool whilst targeting the superficial melanin and vascular component into the epidermis and the superficial dermal component of the skin. So I'm applying a thin layer of gel to the full facial area. I usually apply in sections as I treat, and what I'm going to do is ensure that my white headband is covering the client's earrings as well. I might actually ask her to take them out just to ensure that there's nothing that can potentially reflect any light and cause any issues whilst I'm doing the treatment from a safety perspective. So we've thoroughly cleansed the area, we've applied a nice layer of ultrasound gel, there's no residue on the skin whatsoever, our machine's in standby mode, I have Fitzpatrick skin type my patient, and I'm now going to go ahead and treat in a uniform area, targeting that superficial pigment and vascular component of the skin. What the patient's going to feel is somewhat of an elastic band sensation pinging the skin. Now, it shouldn't be too uncomfortable at the 590 nanometer wavelength because it is more of a deeper wavelength. The more superficial you go, you would feel it more on the surface of the skin. So what I'm going to do is I'm going to move my foot pedal closer and I'm going to put my machine in ready mode. So our machine is now in ready mode and we're going to go ahead and treat the client. We have 2 finger triggers as well as our foot pedal. We need to make sure that our hand positioning is not anywhere near those 2 finger triggers in case we accidentally were to misfire. We're going to go onto the client's skin with a light pressure and we're going to count 1, 2, 3. And you're going to ask your patient on a scale of 1 to 10, how did that feel?
3.
3, perfect. So we're going to continue as we are. And we're going to do 1, 2, 3. 1, 2, 3, 1, 2, 3. What you can do is when you put your device into standby, is you can check the skin endpoint and check that there's no risk of issue, which there's not at this point, so we continue with this setting. So we're going to go in and we're going to do 1, 2, 3, 1, 2, 3, 1, 2, 3, and 1, 2, 3. And finally, 1, 2, 3. We are not overlapping when we are placing our handpiece on the skin. We're making sure that we're doing 1 pass at a time. So if you want to turn your head for me, lovely. 1, 2, 3. 1, 2, 3. We're going to go here, 1, 2, 3. And 1, 2, 3. How was that, lovely?
Fine.
If you want to turn your head towards me now, perfect. And we're going to go 1, 2, 3, 1, 2, 3. To make sure that we are not leaving any local contraindications on the skin. Straight on for me, lovely. So the final piece left is the forehead. What we're going to do to make sure that we're not going on to the hair area is that we're going to first of all just make sure that we have put the device into standby. And we're going to use some dampened gauze onto the area from a safety aspect, and we're going to cut out half of the handpiece just to ensure we're not going to hit any superficial melanin on the skin accidentally. So, going to get ready, and I'm going to make sure the device is in ready mode. And we're going to do 1, 2, 3. 1, 2, 3. How's that, lovely?
Fine.
I'm going to go this way now. 1, 2, 3. 1, 2, 3. I know because I have my gauze here that I'm not going to touch the hairline. 1, 2, 3. 1, 2, 3. And I know that the eyebrows are fully covered over. And then finally, I can fit in one more section here. 1, 2, 3. And we are done. I'm going to put the machine into standby mode. So, the final step now is to remove the client's gel and remove the goggles. Apply a post-procedural point of product, and make sure that you're putting SPF onto the skin, because it's absolutely imperative at this stage that the client protects their skin from the sun. You can see, if you look at Maddie's skin, that we have had a clinical endpoint of her freckles darkening, and that's a really good sign that the melanin has absorbed that LED light and it has actually reacted, so it's darkened and responded to the treatment. What will happen over time is that will then externally exude from the skin, so it will flake off and overall the area will lighten. We would do this treatment on average every 2 to 4 weeks. Ideally, we'd space it out at least every 4 weeks, and for a vascular element, and as a patient ages, you might start to space it out to every 6 weeks based on how long it takes for those areas to heal. So now I've turned my device off. I'm now removing any gel with cool gauze. And at this stage, I could perhaps pop my client under, for example, the Medilux, using a healing LED to help with any downtime associated with the treatment. As you can see, the client isn't too red, but we have got that essential endpoint, which is darkening of that pigmentation, that epidermal pigmentation. So I would be advising my patient that this area will eventually start to crust off, and it will get noticeably better within the next couple of weeks. It's absolutely imperative that our patient wears her SPF and protects the skin accordingly in the meantime. And we would always explain that they would need at least 3 to 6 treatments to get the best before and afters. We can do this treatment not only on the face, we can do it on the neck and décolleté area, as this tends to be quite a common area for women to experience vascular issues and also superficial pigmentation. And sometimes people can be really, really sensitive towards that area, as it can be a sign of superficial aging, as well as on the backs of the hands as well. It's quite a common treatment to do. So at this point, I'm just going to go in with my Epicutis lipid serum, because it is approved post-procedurally and safe to use. I'm then going to go in with my Hivia cream and an SPF before my patient goes home for the day. In terms of aftercare with a treatment like this, SPF and sun exposure is really imperative. So the patient absolutely should not be exposing their skin to the sun. Patient should not be using any harsh exfoliative ingredients. So that includes any actives like chemical exfoliators, as well as physical exfoliators. They shouldn't be using any heat on the skin. So anything like a sauna, a steam room, or they shouldn't be going to the gym for at least 24 to 48 hours. We would give them usually some aftercare in the form of a written form, just so that they don't forget anything, and also some contact details that they can get in contact with anyone should they have any clinical questions or concerns.